For more on this now, we are going to turn to Dr. Jessica Shepard. She is a board-certified gynecologist affiliated with Baylor University Medical Center and an expert on women's health. Doctor, thank you so much for joining us tonight. You know, we see in Kate's announcement there that she didn't specify the type of cancer she has, but she did say that she started chemotherapy. So what can you tell us about the form of treatment, and what does that tell us or inform us about what she might be dealing with?
You know, first and foremost, I think it is important that we make sure that we give them the privacy that they need, especially for a woman and a mother and wife really trying to recover. But with this type of diagnosis, and obviously I was not part of her care, but I have had patients who have been diagnosed with cancer and going through that recovery phase, I do think that we have had some insight to what type of surgery she had, which was abdominal, but we don't quite know what the primary organ was at which they diagnosed the cancer. And I'm sure sometime in the near future, we may see that.
Do we have a sense at all, if you're going to take chemotherapy as a preventative measure, as they said, that it can maybe help her prognosis, or does this give you confidence that the prognosis is better than it otherwise might be?
Yeah, absolutely. When we think of cancer diagnoses, and again, not knowing what specific type, we do know that certain types of cancers, especially in early diagnosis, that chemotherapy does have studies that have shown that can be preventative to future cancers and also for recurrence. So hearing that she's had abdominal surgery and not, again, knowing exactly where it is, that may be from an infectious form, an inflammatory form, but also we know with this cancer diagnosis, with her saying in her own press release that everything was normal at first and then having the cancer diagnosis later on pathology results, that this may have been anywhere in the abdomen or it may have been anywhere in the pelvis. So again, very unclear, but we do know from the type of surgery that she had that this was, again, from the abdominal region and or the pelvic region.
Right, but abdominal region, like you said, can still lead you to other parts of the body. It's still not obvious necessarily what she's dealing with. And also, I would just ask you, Doctor, she talks about the spirituality of this. You even said yourself, it's important to give the family privacy. How draining is it, right, to be in the public spotlight like this and have to deal with all this speculation while you're trying to recover from cancer? How important is it that Kate does kind of go away for a little while and have some time with her family and to herself?
I think that's probably the best thing that they could do at this time. Now, obviously, you know, having dealt with patients who have abdominal surgery, but with a cancer diagnosis especially, and then having preventative chemotherapy, again, you can see that that's going to take a long course of time for many different reasons, because she has to heal from the actual surgery, but now going into a chemotherapy mode, there's going to be a lot of fatigue. There's going to be possibly any nausea, vomiting, and her to be able to do that on her own time with the care of her medical team, but also as a mother taking care of her family. I think that she does require a lot more time, especially being a public figure and making sure that she is completely well before going out into the public eye and making sure that her recovery is a success.
Right. And I think obviously knowing within the full context, Doctor, that you have the king as well, who's suffering from cancer, right? You have two situations within the same family. Everyone right now is a support system, but they're also equally dealing with just a torrent of questions and people wanting to know more about what's going on behind the scenes. Thank you so much for your time and for your insight tonight. We really appreciate it.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.